Hi, I'm Katie. I'm the first year PICU fellow.
And I'm Matt. I'm the third year PICU fellow. Thanks for joining us today on our virtual tour of our cardiac ICU and pediatric ICU here at Golisano Children's Hospital.
We're excited to take you on a tour of our ICUs. Our medical and surgical side has 12 beds and our cardiac side has 16. We work together with each side to help take care of the sickest patients in the hospital, and patients, if needed, can flex between the different sides and the different units. When we're on nights as a fellow, we'll cover for both patients in the medical and the cardiac ICUs. This is our cardiac bay. This is where our sickest cardiac patients come, in addition to our post-op patients and our ECMO patients if we have any of those. Down this hall, you'll see the rest of our cardiac unit. These are all individual rooms, and patients will move into these out of the bay once they've been stabilized. One of the advantages of our program is that we get a lot of cardiac time. We, in addition to covering all the cardiac patients on nights, we do spend dedicated time in the cardiac ICU, carrying patients as their primary covering provider.
When we work in the cardiac ICU, we get to work closely with APPs, and I'm here with Tori Daru, one of our APPs, who we get to work with.
Hi, I'm Tori. I am the lead APP for the Peds Cardiac ICU, and we really love working with our fellows. We have a great fellow group.
One of the other really exciting things about our program is the opportunity to participate in high fidelity sims. This is one of our cardiac attendings and the director of simulation, Dr. Taylor Wheaton.
Hi guys! We're setting up for a sim this afternoon actually. We do multidisciplinary sims with nursing, pharmacy, respiratory, our nurse practitioners and APPs, as well as our lovely fellows. And so Katie and Matt are actually going to join us this afternoon for a multidisciplinary scenario. Better hide everything so they don't figure out what it is.
Another great part about our program is our opportunity to field transport calls for outside hospitals. We have an excellent transport team comprised of highly skilled nurses, respiratory therapists, and EMTs who help to bring patients from various hospitals in our community.
My name's Amber. I'm on the pediatric transport team. I've been here for about a year now. Basically, we have a lot of different roles that we do in the hospital and out of the hospital. We have an ambulance that we actually have our own ambulance that we use, and then also with helicopters and fixed wings. We travel all over the state of New York and even outside of the state to pick kids up and bring them back to the hospital. It's a really fun opportunity, and we get to work with the fellows very closely. So not only do the fellows go through doing the calls with us, the initial calls and making medical recommendations, but they also get to accompany us on a lot of the transports that we do all around the state and outside of the state. So they get to come with us, make medical decisions, and then help us treat the patient and get them back to the hospital safely.
As fellows, we lead multidisciplinary rounds with our attendings, our nurses, residents, in addition to our pharmacy staff and respiratory therapists and other members of our team. As fellows, we work closely with our nurses and nurse managers to help ensure the best care for our patients.
Hi, I'm Karen. I'm the nurse manager here in the PICU. We love our fellowship program. It's so great to see them working with our teams, our big interdisciplinary teams with everybody included, and watching them grow as they progress through the program. Hope to see you soon.
We are a level 1 trauma center serving Western New York from Lake Ontario down to the Pennsylvania border. We are also a regional burn center, so we take care of all the burn patients who need ICU level care. This is our procedure room. We have the ability as fellows to do multiple procedures throughout our time here. We often are the go-to people for central lines, intubations, chest tubes, and other procedures here in the ICU. As you can see, we have technology that we use such as ultrasound, our defibrillators, and a CMAC machine as well to help us with our procedures. In our program, we get the option to do several electives throughout our time. In our first year, we're able to do an entire month of cardiothoracic surgery, where we get to really spend time in the OR seeing the congenital heart anomalies that get corrected, and then the patients that we take care of later in the cardiac ICU. We also work on our intubation skills with anesthesia during the first year. Throughout the rest of our time, we have the option to join the vascular access team, sedation service, palliative care team, or other areas in the hospital to do electives. This year I'll be doing a vascular access elective as well as a palliative care elective.
We also get to work closely with our care coordinators to help ensure smooth transition of care to the outpatient setting.
My name's Allison Parcells. I'm the care coordinator on the PICU side.
Hi, I'm Adrienne Frankel. I'm the care coordinator in the Peds Cardiac ICU, and we do a lot of the discharge planning and family education for our complex kids going home.
Thank you so much for joining us.
We look forward to meeting you on interview day. Feel free to reach out with any questions.